So tonight, this is an open office hour session where we're going to walk you through some of the different programs that we have at our school, how they work together, and how you can proceed through. At the start of every year in January, I always get a ton of emails of people asking how to work their way through a program. And the best way to do it, because our programs are very large, they have a lot of depth to them, and if you're not accustomed to it, it can be a little bit confusing. And I apologize, I'm getting over a really bad cold, or flu rather, and I'm still a little bit scratchy throated, so I apologize about that. As soon as there's a question that doesn't involve me, I'll run and get a throat lozenge. But um, how would you guys like to start this? Does somebody have a program that you would like me to speak about, and I can go into depth, go all the way through it, and answer any questions that you have on that? In chat, just go ahead if you would like to start off with like, which program are you curious about? Please make sure. Okay, great. So Tony is asking about the Clinical Herbalism Program. Hold on just a second, and I have program diagrams that are gonna break it down for you, but I am gonna grab a throat lozenge so I don't have to keep clearing my throat. Give me 1 second. So I will start off with, yes, okay, so let's go through this. I'm gonna start by going through the Clinical Herbalism Program. I will cover the Austere Program, and I'm gonna talk about, as part of the Clinical Herbalism Program, Sam and I will both talk about the mentorship program that's within the clinical program. And of course, I can definitely do apothecaries as well. So let's go ahead and let me share my screen with you and pull up. I'm going to go through where we got it. Here we go. All right. I'm going to go through this, and some of you have seen this in the intro class. So hold on a second. Let me pull it up for you. Here we go. All right. Share. Here we go. Okay. So I hope you can see this on the screen. This is our most in-depth program that we have. Depending on what your time looks like, you could go through this rather quickly, or it might take you years. And we do have students who have been working on this program for years, multiple years, as they have time to do it. And it does take a little bit of work. It is a lot more in depth than most of the herbalism programs that are out there. And let me walk you through how this works. Now, there are 4 levels to this, and some people may just be fine with being an apprentice clinician, okay? That's as far as they need to or want to go, and they want just a basic herbal practice. And I have diagrams that are going to break down all 4 of these levels. But as you can see here, these are pretty in-depth, and they cover quite a bit of material. And the end goal is to make sure that when students leave our clinical program, or any of our programs, honestly, that they have the verbal language to be able to communicate with other healthcare providers. They feel comfortable about contraindications and when to appropriately use herbs and what those herbs are, how to mix herbs together, how to be competent with other types of therapy, and so forth. So this is a program I'm really proud. Oh, darn it. Hold on just a moment. The yeah. Okay. I'm really proud of this program because of the depth that it has. And it is something we've worked on for years, and we've been adding to it and giving a lot more depth to the program as things have come up. And we've added things in, we've kind of streamlined other things, and so forth. So this is the 2025 Clinical Herbalism Program. If you want any of these diagrams, by the way, all that you need to do is to send me an email. I'm putting my email right here in chat. send me an email and I will send you any program diagram that you request. Okay, so this is the overall program with all 4 levels spelled out. Now let's talk about what those look like. Let me pull this up for you. Oops, that is expert. Hold on. Technical. Okay, here we go. This is the one we want. We're going to start right here. Okay, so you're starting in our school and you're thinking, what are the first steps? And again, this is level 1, and this is actually pretty in-depth. So level 1, if some of you are in tonight's class have already, or you're in right now, the Introduction for Herbal Medicine for Beginners. You can see that is optional. And then we have the HMP, that is Herbal Medicine for Professionals. That's a 12-week guided, meaning that there are instructors present every week to walk you through your questions and give you a little bit of structure around that. That one is considered to be our foundation class. And I bring this up because if you're going through any of our programs, you want this one, because this is a class that gives you the language to be able to communicate about working with herbs in a competent way that allows people to, when you're speaking with them about herbs, allows them to say, okay, well, this person understands what they're doing and they have a basic knowledge of anatomy and physiology, a basic. And I say that because there is a lot of depth that many herbalists don't possess. It's kind of a little bit one-sided, and it's about, okay, so I use this herb for this, but they may or may not understand the very important aspects of anatomy and physiology that go into how the body systems work, what is actually happening on a physiological level, and when we do or don't want to have herbs, or when there are even um, sorry, when there are, when you should not mix, sorry, it's a long day, and when you should not mix pharmacology and herbs together. So those are things that it's very important to understand. So step 2 is HMP. This is, and I will stress this is the beginning. So Sam has been doing herbalism for going on, gosh, like at least 35, if not more years at least. And he's still learning. And as he has added in different modalities behind him, he did his master's of acupuncture. Oh, really? Okay, I guess I'm going to be in the dark. So he's added in his master's of acupuncture and is constantly pushing himself in new directions. So it is not something, anytime you hear somebody talk about, I'm going to be a master herbalist and taking a weekend course, please be wary of that, because that is something you're going to, I mean, it represents years and years of practice and understanding, keeping up with medical, what's going on in the medical field with research, and really having an understanding of how that relates to herbal medicine. So it's very important. So this is the beginning. I want to stress that. We have a total of 12 pathophysiology modules, and there are 4 of these in each one of levels 1, 2, and 3. Okay, and you can see step number 3, we go through the infection and inflammation, which is a really important one. Head, ears, eyes, nose, and throat. That one, I believe, just started on Monday. Anybody can jump into that. Liver and the hepatic system as it relates to herbalism, and the digestive system for the herbalist. You can take these on demand. As soon as you have finished herbal medicine, or what we call HMP, you can take any of the things that follow on demand. So with the exception of step number 4. These are SOAP note study classes. Sam does, I believe, 8 of them each semester. And you go through different topics like GERD or migraines, or I can't think offhand of some of the ones that he's done beyond that, but every semester there are 8 new ones, and students have the ability to gain some of their clinical hours by attending these. These SOAP notes classes are 2 hours long. You get 2 clinical hours from doing that, and it allows you to be able in real time to work through a case study, what you would do. You work as a team, and you submit at the end of the class what your protocol would be. It's a really, really great way of getting kind of that like training wheels work with clinical herbalism in a safe environment that is guided and mentored in that way. Step number 5, we have some of our clinical studies, which include, in this case, the clinical physical assessment course that's done with me, and the clinical nutrition course, which is every fall, and that is done with one of our faculty members who is a functional medicine MD, Dr. Kyla Helm. She does that once a year in the fall. It is, and we always have people who say, well, I took a nutrition class in college. I can guarantee you this is not the nutrition class that you took in college. This is quite a bit more in depth, and it also relates to how does it work with herbalism. And herbalism should not be just like a singular blinders on approach to herbs are the only way to go and this is the only thing that we need to do, because you do need to bring in all of the skill sets that you see here, from being able to look at a person and do a physical assessment, being able to competently understand what's going on with their nutrition, their diet, their movement, their lifestyle, any drugs that they may be taking, and so forth. These all play into that. Step number 6, herbal management for acute viral infections. We do that twice a year. This is really an important class. Some of you are probably taking it right now, and it will come around again in August. And Vanessa, if you would put the link in chat for people, I cannot stress how important this class is specifically right now, when information about what is happening in our health environment is somewhat limited. So understanding what viruses are out there, for example, I became quite sick in January, and I was not sure if I was dealing with the avian flu, which was H5N1, of which I had all the symptoms for, or if it was influenza A, which is running rampant through many communities and is a very serious respiratory illness that is causing hospitalizations left and right. Because our information to what is happening in the healthcare world is a little bit limited right now, for a person who doesn't know how to find out that information or doesn't understand what the symptoms are and how it presents and what to do about it, they're kind of in the dark a little bit, and that can be a really scary thing. And it is also scary for healthcare providers who may not be as up to date on what is happening as well. So if you have not taken this class, put it at the top of your list. This is something, all of these are something, but this one in particular is something that really will help people to understand how to take care of what is happening with their health on their own. Okay? Not entirely on your own, but understanding, oh, I think this is RSV, or oh, I think this is, herpes simplex virus, or whatever it is. It allows them to be able to have the empowerment to be able to understand what's going on. So it's critically important, in my opinion. Wound and infection management is another one. These two right here on step number 6 are at the top of my list for critically important self-education classes. This one for understanding what is going on with the skin. You're looking at a wound. Is it infected? What stage of infection is it healing? What can I do about this, with herbs, without herbs? This is one of those classes that is especially important if you have people if you're working with people who are in underserved areas, in community environments where they're not getting the care that they need. This is something that can be indispensable, especially, for example, if you have someone in your life who is diabetic, or you're working with someone who is diabetic, you know that you need to keep a close eye on their feet, because diabetic ulcers, they won't feel. They won't feel necessarily what's going on with their feet. And just making sure that you're doing good foot care and looking at these things can mean the difference between making sure everything is okay or them losing toes. And I have seen this in our local hospital. Diabetics come in and they literally, their toes just kind of slough off in front of you, and it's a horrible thing to witness. It can be preventable, and they have no idea. They have no idea because they can't feel it. So understanding a little bit about wound and infection management and how herbs work with that. And I will say, this is an area I personally feel like herbs are stellar at working at. They're very, very good at helping to keep things from escalating. All right, and step number 7, every level has what you see here. This one has a level 1 exam. If you pass it with an 80% or higher, then you become a level 1 apprentice clinician through our school. And it opens access at that point, and once you pass that test, to 50 mentorship hours. And when I'm done with all 4 of these levels, I'll have Sam talk about the mentorship here in a moment. Okay, so that's level 1. Okay, I'm going to power through level 2 through 4, and then I'll take questions from you on this. Here's level 2. So you've finished your basics, you've been awarded your certificate, and then you're like, I'm ready to go. I'm ready for whatever the next step is. That would be every March. Clinical case management for herbalists. You do need to have completed the HMP in order to take this class with Carol, who's one of our advanced clinicians. She does it every March, once a year. Okay, so if you're thinking, if you've already done a lot of level 1 and you're thinking, what is the next step? It's step number 1, clinical case management for herbalists. There are 4 more pathophysiology modules. You can see them listed under step 2, the endocrine system, immune system, respiratory, and genitourinary. These do not, and you see you can take them on demand. They don't necessarily have to be taken in order. This is just the way that it's laid out. If you want to become a clinical herbalist and apply for the RH, which is the Registered Herbalist application through the American Herbalist Guild, and yes, we do meet all of the requirements in order to do that application. You can bulk up and have multiple patho modules that you add on and do on demand, or you can take them as a guided course with an instructor who answers your questions each week. So that's step number 2. The application, the only, and I hesitate to say the word regulation because it really isn't. The only recognized herbal, there is no licensure, and Sam can talk about this as well when I'm done here. There is no licensure, and there is no true master herbalist designation. It's not like getting a degree program from an accredited university. That does not yet exist in this format. However, the American Herbalist Guild has something called a registered herbalist. And if you decide to do that, not just our school, all schools have to, if you come through and want to do your RH application, you have to complete a certain number of hours in a certain areas, everything from botany to medicine making to working with clinical hours, doing mentorships and so forth. The hours are the same no matter what school you go to. All right, so our school does meet all of the requirements that are needed in order to do that application. Okay, no, there is not a school out there that just awards you an RH. You have to go through and complete their application and then be submitted for review. That's across the board. It does not matter which school you go to, they still have to review it. All right, so step number 3. There are more clinical studies courses. In this case, we have the herbal first aid course, formulas and formulating and formulas. Formulating and formulas is offered every June. The herbal first aid is online. It's an 8-hour course. It actually is coming up in March, along with the wilderness first aid. We do require our students to do, and I'm glad that we do. We require our students to do a wilderness first aid, or a WFA, because it is my personal, and I believe Sam's opinion as well, that having that basic knowledge of what to do when you are outside the scope of having an urgent care right around the corner, and also how to work with herbs if you're in the field, can be critically important. All right, so that is step 3 and step 4. You have 8 more topics that you add on with a SOAP clinical case studies, and then there's the exam. So this will award the technical clinician certificate, and that opens access to an additional 100 mentorship hours. All right, so let me move on to level 3 for you. Hold on a second. Let me pull it up. Here we go. Don't worry, I'm nearly done talking about the clinical program. Hang on. All right, so this is level 3. At this point, we move into the professional clinician. And this one right here, botanical functional medicine, that's the first one. And this is with Dr. Helm. It's every January, so it's already in play, but it'll come back around again next January. The 4 pathomodules for this level are the skin, integumentary, cardiovascular, musculoskeletal, and the nervous system. And again, just like all the other levels, you can do these on demand. There are additional clinical case courses like botany, and of course that WFA course. 8 more SOAP sessions that are guided, as I mentioned, the other 2 levels. And then there is a level 3 exam, which gives access to 150 mentorship hours. So a student has the ability to get a ton of the mentorship hours that you need. Okay. And here's the final level, which is the highest level. And this is this is for the advanced clinician student. By the time you reach level 4, you should be feeling really comfortable with your ability to communicate with herbs. You have options here. With option number 1 and 2, you can either do the Botanical Functional Medicine 2, which will be coming out probably in 2026, or you can do an approved capstone thesis project, which is what a lot of our students are doing right now, because it gives them the ability to really hone in on a topic that they're very interested in regards to herbal medicine and science or applications or something that they really want to know more about. So it's think of it as being a little bit like an independent study, just the same way if you were doing your, I don't know, your thesis project in a college. Step number 3, this is on-site and online clinical rotation hours and your remaining mentorship hours, anything you haven't completed. And there is a final exam that is kind of the cumulative with everything to that point, showing that you are competent and ready to complete this program, as well as step number 5 is program completion. You're now an expert clinician through our program. It is a very thorough program. And again, I'm really proud of the depth that we have, because I can tell you, having just finished nursing school, that we actually go into a lot more depth in some of these topics than what I experienced in school. And I went to a pretty good school. All right, so these are the 4 levels of the clinical program. Let's see here. Here's the diagram of this. And again, one more time, if you want to have any of these diagrams emailed to you, all that you need to do is, my email is in chat. All you need to do is email me at thehumanpathschool@gmail.com, and I will send it to you on that. So this is the clinical program. And I want to, real quick here, on level 4, right here where it says step number 3, on-site and online clinical rotation hours. This is something during COVID, we had to slow this down a little bit. And then I went to nursing school and I lost the last 2.5 years of my life in that. But now I'm quite excited that we're going to be able to start doing this. And one of the first places that I am hopeful for, provided that the federal funding is not cut, is to be able to offer 6 clinical students the ability to train on site when I am teaching. I'm going to be teaching a wilderness first aid class for the Shopai tribe in north central Nevada. Knock on wood, hopefully those funds will still be there in order to be able to help these people. In which case, we will be doing in the evenings, we will be doing an herbal clinic, and we will have 3 clinical students in the front of the house doing intake, sitting down, talking to and working with members from the tribe, asking them, what brings you in today? How can we help you? What would you like to accomplish? Tell me your signs and symptoms. What do you know, and so forth. And then 3 apothecaries in the back of the house working with me, making the formulas, putting them together, and in charge of doing client education, which means, let me show you how to take this formula, and this is how you do it. This is how often you do it. What questions do you have? These are very, very, very important clinical skills. and they switch. These students have the ability to work on both sides of the house, so to speak. So when I say on site, I'm not talking about doing an intake for, your spouse or your dog or, your kids or whatever. I'm talking about working with people who are outside of the community that you may be accustomed to working with, people who have, real needs and people who are real cases. And those are ways that you will be able to count clinical hours towards that RH application, as well as really getting some invaluable experience working with people who need help. And it's they're always, because we always work with underserved communities, they're always working with people they're pretty underserved, typically, the places that we work. Okay, so I have just described to you our clinical program and all four levels, and it is pretty extensive. So I'm going to scroll back up and see regarding the clinical program. Remember, I'll move on to the other ones in a moment. Let me just make sure I'm not missing any questions. And if you feel like this has answered your question, just said, yeah, that's good in chat. But if I've missed something, now is the time to ask me about the clinical program. Okay. I will let Sam talk about the mentorship program requirements in here in a moment. Major differences between programs, I will do that. Involvement with people, variance by program, okay. Making a business out of it. Medical liability, being relied on, however incorrectly, for giving medical advice, even if you're not. That is some tricky territory and something that we do cover a little bit in the HMP. That is in here, step number 2. So Sam covers a little bit of the legalities that surround herbal medicine and herbalists when you're practicing, things that you should and shouldn't say. I talk about it a little bit as well in my clinical physical assessment course, which is step number 5. But it really, especially now, it's a moving target. So we all have to be extremely careful about what we are doing and make sure that we're not overstepping the scope of our practice. All right, so let's see here. Is the difference between registered clinical herbalist and not registered registration through Herbalist Guild? Okay, so here's the difference. So you can complete our program and you can be fully competent, very competent, to be able to do pretty much anything that you need to within the bounds of herbal medicine, practicing and working in the field, working in a clinic, working alongside healthcare providers, and so forth. You'll be very, very knowledgeable in the field of herbal medicine. What does the RH give you? It gives you 2 letters after your name. It is not recognized by the American Medical Association or by nursing or by any allopathic organization. It is there for herbalists who feel like they need to have 2 letters after their name. It may offer you a sense of security, and it may give you the feeling of having a designation. However, it's not a licensure. And I just want everybody to be aware that it is not like having an RN or an MD or an NP after your name. This is simply, herbalism is a little bit of a moving target. Okay. I'm glad you are loving HEENT. It's a fantastic course, especially right now. There's a lot of respiratory stuff going on. HEENT, which is head, ears, eyes, nose, and throat for the herbalist, is really important to understand everything. I mean, you're right here, your face hole, is where both your digestive and your respiratory system start. So that's pretty important to understand how herbs affect this area of your body and how you can work with that. Okay, let me move through questions. What classes cover 16 hours of botany instruction on level 3 of the clinical program? Kelly, we have, I think it is 6 hours online, but there is an on-site 2-day botany course that we do once a year through, we have Kat McKinnon, who is an advanced clinical herbalist from Colorado, who comes down and she teaches this for us. If you are in another part of the country and you simply can't make it, just submit what you have, but you do need a minimum of 16 hours to complete our program. You would just submit it to us. Okay. And then, oh, Sam, you mean Kat McKinnon, not Kat Meyer.
Yeah, sorry. I don't know where my head was when I was typing that.
On demand. So Gary's asking what is, Sam answer this one too? Yeah, okay, Sam answered that. How much of these classes are available online? So let's look here. Intro for Beginners is, we do offer that as a guided course 2 times a year. It's in progress right now, but you can do it on demand if you are just starting and you don't know, you feel like you need, like, where do I begin? You can take this on demand. And I will have Vanessa post the link. We have an online classroom that allows for on-demand courses that you can do that. So that one is available. HMP is not available on demand because it is a beast of a course, and we feel like it is much easier to navigate that with the weekly sessions that we have with instructors who are skilled in that. Your pathophysiology modules can be done on demand, all 12 of them, or you can move through them. There's 4 a year. You can move through them when they are offered with our instructor to help you with any questions you have. The SOAP notes study classes will not be on demand. Those are one of the few things that you really need to be present and do that. And it's just 2 hours in, for each one of those 8 sections each semester. And then a clinical physical assessment, no. Same with nutrition. Those are not on demand. Herbal management for acute viral infections, no. Wound and infection management, no. So really what that boils down to is your pathophysiology and your intro course are on demand. You can do those. And then as we go through the levels, all of the, let's see here, there's level 2, patho on demand. The others do need to be done with an instructor. Level 3, same thing. This is step 1 is with an instructor. Patho can be done online. The botany is in person. Same with the wilderness first aid. You can do that in person, which I think is a great way to do it. Or you can do it online, but it is a guided class with me at the end, making sure you understand this. SOAP notes are, the SOAP notes are guided. Okay. So yeah, no prerequisites for the wilderness first aid. It's coming up. I think this next month it is online, and we will be doing it at our Taos campus in May. So if you want to get that done, you can do that. Let's see. Yes, Simone is asking, can we get credit for wound and infection management? Sam, have you answered all these questions? Yes, you can. Okay. If you can't do an on-site in-person, can you still have enough hours in training to become, pretty much, yeah. The only thing that yes, you can, because we have several students who have never set foot on our campus, and they are doing their mentorship hours with Sam, which he'll talk about in a moment. And they have done their botany in the area that they live in. But everything really is available to do online, and he'll talk about that in a second. Let's see. Gray is saying, some of the classes that I completed and got credited for not listed in the new classroom. Is there somewhere? Oh, absolutely. So Gray, what you
I answered
need,
that.
oh, you did. Okay, great. Okay. Yeah, Anna will do that. Is there botany on site? We're working on that. That will be in September of 2025. Possibly the 21st to the 23rd. We need to confirm that. On demand is not the same. Okay. Right. Okay. So I think I've caught up. Sam, do you want to talk about mentorship?
Sure. Yeah. And back to the kind of where you started with hold on, one question Laura came back with, just to clarify, can be all done remotely. That's correct, Laura. The only classes that have to be on site really is a WFR. We can't, that has to be in person. That's just something that um, I know there are some schools out there, some wilderness schools out there that are doing online ones now, but I can't. I just can't feel like we can give a WFR out to somebody that we haven't physically worked with and seen their skill levels, through the testing and so forth on site. So that's really the only one. I think emergency birth, right, Suchil, is also has to be on site.
Actually, no. Those are in the austere program. These are the ones Sam is talking about, the WFR and emergency birth, are part of the austere medicine program. With the emergency birth course, you do have the option. You can do your evaluation and testing out of emergency birth online. However, if you're going to take one class on site, emergency birth, it's very difficult to do emergency childbirth if it's not in person. It's one of those, it's worth it to do it on site. And it's necessary to have that kind of feedback that you get from being in a live scenario, with a doll, not an actual baby, but that and of course the WFR.
Yeah. So otherwise, everything can be done on site or online, and that includes even your clinical hours. So back, just to touch on briefly what Sucha was talking about. So, um, and you'll get this if you're taking the HMP. I get into this in great detail. The difference between certification versus registration versus licensing, and the fact that certification is really it's just based on what the school gives you. I mean, it's only as good as the paper it's printed on and the reputation of the school that's giving you the certification. Now, frankly, every school should be offering you some form of certification, some form of, documenting your hours and so forth. If you're taking their classes, that's a given, right? That should be a given, hopefully. But registration, the registered herbalism, it's kind of I've joined and left the ASG several times since the 90s, and it's had its bad times, its good times, it's having a bad, in my opinion, it's in a down, it's down right now. They've got problems. But it is sort of a due diligence, you could call it maybe, of peer review. It's a peer review. You submit your application, you submit that you've had clinical hours and so forth. And if nothing else, it's a goal, and a goal helps you learn. At least for me, I always need to have goals in order to learn. And that's why I like to do those kinds of things. I like to get certifications. I like to get degrees, not because I'm trying to just collect the degrees, but because it gives me a goal to work toward, and it's more tangible. So I mean, I applaud anybody doing that, and like Suchil said, we actually more than meet any of the requirements that they have, and of course, gladly I will give you. You have to have a reference, a letter of reference from I think at least one registered herbalist, which I am, and I'm a registered herbalist, obviously, and so I certainly do that for my students as well. And then there's licensing, and licensing is a state by state situation, and varies by medical field. So in other words, chiropractors are licensed. Obviously, MDs and DOs are licensed. NPs are licensed. RNs are licensed. PAs are licensed. EMTs are licensed. Actually, EMTs get a national registry thing, and then according to the state that they're working with, and whatever those laws are as well. Paramedics, the same thing. Um, there's no such thing as a licensed herbalist. The closest that I think you can get to it is what I've done, which is to become an acupuncturist, because state by state, with I don't know, something like 46 or 47 states out there license acupuncturists. There's a couple that don't still, but otherwise you can be a licensed acupuncturist, which gives you the ability in most of those states to also be a licensed herbologist or to work with herbs. And of course, it's from a TCM perspective, but that doesn't make any difference. You're still able to work with herbs how you want to work with herbs. Nobody is going to come and check and make sure that, you didn't use, you know, you didn't use a Chinese herb. Instead, you used a Western herb or something that's ludicrous. Of course, that's not going to happen. So really, that's the closest thing I think to being a licensed herbalist you can be. Now, something else you can be in about, I don't know how many states it is now, 13, 17, something like that. You can be a licensed naturopath, and naturopaths in licensed states are also licensed technically to work with herbs or with supplements. You don't really get much herbal training, in my opinion, or very good herbal training in most naturopathic schools, but it gives you the license to be able to do that, especially if you're already coming from an herbalist background. Chiropractors technically are also licensed, and they work with, from state to state, are able to work with herbs and supplements and so forth too. So, and this is important, at least it used to be a very important distinction. It still is, but it used to be even worse, is that if you're a doctor, an MD or a DO, and you just start giving out herbs, you're going to get, there are a lot of doctors that lost their licenses or got kicked out and ran out of states for using herbs and supplements and charged with practicing outside the scope of their license. It's not within the scope of your license to use herbs as a doctor. Now, if you're a functional medicine practitioner, that's starting to get a nice gray area that's allowing that and is better, again, from state to state. But even that is still a problem. Kyla, our faculty member who's a functional medicine doc, has run into that problem many times herself, and she'll talk about that in the BFM every year, some of the difficulties she's had as a functional medicine practitioner trying to work with herbs and supplements as an MD. The system is very much locked against it, but slowly it's becoming unlocked. Okay, so hopefully that kind of helped clear that up. Now, from our standpoint, mentorship and clinical hours, you have to have, so again, back to the AHG, if you're trying to get an RH, you have to have 400 clinical hours that are documented. So you can get those from us, or if you're just documenting the hours for yourself or for something else, maybe you're going for an American Naturopathic Society board certification, you can do that, and you document a certain number of clinical hours for that and so forth. Whatever it is that you're documenting those hours for, we do that for you and work with you on that, of course, too. So that first starts after the HMP, in my opinion, and why I set this up this way, is that first starts with the SOAP note classes. That SOAP note classes are the bridge between sort of the didactic side of the HMP, which is really our entry level course into herbalism and actually working in a clinical capacity. So those SOAP note classes are really critical. And in that process, what you basically do is you log in and you can just pick and choose. You can cherry pick. You can say, hey, I want to learn about, I want to do interstitial cystitis tonight, or I want to do, whatever, a soft tissue injury, trauma, or I want to, whatever the topic is. So when you see it come up, you can say, hey, I'm going to do that, or you can just buy them as a package. They're not expensive. It's 2 hours. You basically pay for me to be your client or patient, however you'd like to see it, and I will. There's already assessment that's been done in the sense that we already know what the condition is, at least from a Western standpoint. It's your job to ask me questions and get all the symptomology around it, signs and symptoms and so forth around all of that and document it. And then the most important part of it is that you come up with protocols. And so you take those protocols, you paste them into the chat. We do it in Zoom, and then you have a certain amount of time. We ask questions for a certain amount of time. I give you about half an hour to come up with your protocols. Everybody pastes in their protocols. If you're brand new to it, sometimes people will team up in a breakout room, but normally everybody just does it by themselves. And then you paste those up, and then I review each one and we talk about it. I might ask you questions. Okay, why this herb? And did you consider this or did you consider that? And then you may tweak your formulas by the time we're done. And when you're done with that, then you put it onto your SOAP note, you turn that in, and you get 2 hours credit for that. Now that is very similar to how we run our clinics, our actual clinics, like Suchil was talking about. If we're, when we work with underserved communities, whether it's Native American nations or whatever it may be, post-disaster, is students will sit and take intake, very much like this SOAP note class. And, you'll get about 10 to 15 minutes to do that. Because usually we'll have a lot. It's a full clinic. We might see as many as 100 people in a day, so it's packed. And I'll run 3 tables, or whoever the clinical director is. We have some very advanced students that are becoming part of faculty that are going to be running these as well as clinical directors. But for me, it was always pretty much 3 was the magic number. 4, I start to be the bottleneck, and 2 is a bottleneck on the table. So about 3 is perfect. So I bounce from table to table, spend about 5 minutes on each one. Yeah, the student has spent, or students, usually there's a pair of clinical students that are taken intake. About 15 minutes, I take a couple minutes for them to tell me what's going on. I ask the questions that they've either missed or that they haven't followed up on that I feel like I need to know. And then I push out a protocol, and, wait for any questions from the students or the patient, and then move to the next table. And so that's kind of how that works. So it's fast and furious, but it's the same idea. And in the soap note class is kind of a slower, more methodical version of that, where you get to do it yourself and everything from start to finish in your own protocols, and you're learning the plant names because you have to use botanical names. It's just the same format as our clinical soap note that you're going to turn into the apothecary that's going to create the formula for the patient that came into the clinic. It's run exactly the same way. So you get to use the same paperwork, the same formatting, all of the stuff that you need to do, and it's going to make you a really proficient clinician, because you're going to do it over and over and over again. You're going to see lots of different stuff. You're going to make some mistakes. You're going to learn from those mistakes, and that's what that's designed to be. So that sets you up then for the mentorship hours. So what you can do is you're allowed up to 100 hours by AHG, um, whatever, not regulations, but whatever their stipulations are. I think is up to 100 hours of kind of clinical hours that you can get in sort of a didactic or scholastic environment. So that would include the soap notes, for instance. That would include, any kind of sitting in as sort of shadowing, if you wanted to do that. But normally, by the time somebody's gone through all, what is it, 32? Basically, I think it's 8 times 4, right? Because we have one, or is it 8 times? Let's see, we have two 8-week segments per year. So, and then for 2 years. So yeah, 32 of them. So 32 total different. You could go literally 2 years and not see the same soap note, right? If you went through every one of them. And so by the time you've done that, you're ready to start mentorship, in my opinion. Usually you should be. And that means friends and family, people you're just helping, whatever. And so once you've done that and you've started helping people and you're writing up a soap note, then what you do is you get 4 or even 5, starting, I would say 4. And then as you get a little better at it, as many as 5 together. And then you schedule on my clinical, herbalmedics.clinic, which is my clinical portal, you schedule a mentorship time with me, which is basically, it's usually about 50 minutes. I mean, it can go up to an hour if we need to. It's $100. You can do, like I say, once you're good at it, you can do five mentorship, mentorship cases with me, where we review it, we run through it. I give you feedback. I might say, you might think about this rather than that, and so forth. And then and then you turn those in through our system, and I give you credit. Our school gives you credit for those hours as well. So you have documented mentorship hour credit as well. So whatever that comes out to, I guess that comes out to like $20 a case, if you're doing it that way. And hopefully that is affordable for everybody. That's my goal, was to be affordable. There are people on the AHG mentorship program are charging, students like $200 for one case for an hour, like ridiculous things. This is not meant to get anybody rich, but I do need to have my time compensated. So that's kind of how hopefully we've struck a balance with that, and it's going to work for students to be able to do it that way. So that's really, just kind of starting out now, because there's been so much demand for mentorship hours, and we have not had enough time available. I just haven't. I've been too busy to have time available for shadowing hours for students. So I think this is a better approach anyway, allows you to do things on your own and then come to me. And so it kind of fosters that independent thinking and independent spirit of, you as becoming a clinician, and then allowing me to just review it for you. And I don't care if we can get through 6 cases, we can do that. If we can move through it as you get good at it, it shouldn't be, and where I can trust your judgment really well. It should be something that we can just zip through pretty quickly when it comes to the mentorship. Okay. Let's see. Yes, there's a question about the grid for programs as to when. That's a great idea. And I don't know if we have that in that format, but we can certainly make something like that. I would love us to make something like that, so that you can really see by schedule when you could step through these things if they're not on demand.
Yeah. I started doing these updated, like the ones you see here, the clinical program and then the levels. I started doing these in January, but then I got that horrible flu and I'm a little bit behind, but I will be posting more user-friendly diagrams so that people can understand exactly what is in the program. Sandra says, if we're not actively seeing clients, can we make up cases that we can research and go through as mentorship cases? Sam, that's a make up, like not real people?
I would say, you could try that for a few, to just get the idea. You can come up with something that maybe you didn't get in a soap note course that you want to, or maybe something you read about, or maybe something you dealt with in your past or a family member has dealt with, and come up with that for a few cases, that's fine. And really more of a learning situation. But I mean, eventually you're going to have to, if you want to get through the clinical program, you're going to have to get the clinical hours. That's just kind of how it works. That's the whole idea of doing the program, is to be a
Yeah,
clinician.
I don't think the AHG will accept made up cases. They have to be documented real people as I understand it.
Well, they do, but again, I mean, if it's like the soap note isn't a real case. I mean, technically, I take them off of one or maybe sometimes a mix of different cases in my
Hmm.
own, out of thousands of cases. A lot of times it's just off my memory. I'll be like, oh yeah, I remember this GERD patient, a such and such, and I'll kind of
Sure,
imitate those symptoms. But again, that's in the beginning. I mean, that's before you get to the mentorship side. So the soap
sure.
note should give you all of that, actually.
Right. Okay. And then Laura is pointing out, would I be able to use patients anonymized from my functional medicine practice as cases? That would be a yes, right?
Yeah, absolutely. Sure. If they're your patients at all, you can absolutely use them. So in a mentorship situation, though, what we are expecting, again, that it's not just hypothetical, and I don't know if that's what you're saying, but that you have actually worked with them with herbs and that you've done maybe a follow-up or two, hopefully, and so forth. That's that's important, that they're actual physical cases that you worked with herbs with.
Right.
Okay,
And
yeah,
Kelly,
perfect then. Absolutely, Laura. Totally.
yes. And Kelly says, I really appreciate this new spreadsheet. I've taken classes all over this. I did highlight the ones I've taken. Yeah, this was long overdue, and it was requested in December. They're like, hey, this is confusing. And so I tried to really make this streamline. And I did this I made it all the way through the austere program before I got the influenza. But yes, Kelly, that would work just fine. And for AHG, do I need to be registered
I
with
answered.
them? No. Before getting credit for clinical hours, or can that be done retroactively? Yeah, yeah, that's fine. You don't, in order to put in your RH application, you do not need to be like a member with them.
No. Kelly did an 8-hour botany count. I'm sure, yeah, we'll count it towards the botany hours for sure, Kelly.
Hmm. Should we really be looking into some sort of accredited program through which to use our clinical herbalism training? Or are there positions for someone who just has a clinical herbalism training? I would say both. So
I'm, I
did
was
you?
gonna, let me say some of that because I
Sure,
didn't talk about accreditation in that,
sure.
what I was talking about with certification. So then there's one other thing, and that is accredited university hours where you can get a degree. And there are a few out there. There are a few universities out there where you can get an accredited bachelor's of holistic medicine, and maybe even there are some, I think, where they'll even use the word herbal medicine in them. The problem with that is that any accredited program out there, unfortunately, and I would like to change this, by the way, this is part of my vision for our school, is to eventually get accreditation and have a clinical program with that. Because the problem is, any of the schools that have accreditation are not going to give you actual clinical experience. And the reason for that is it's too dangerous for them to do that. Number one, they normally they just don't have the experience. It's not like even acupuncture, it's like when I did my acupuncture degree, I had to do, I don't know what it was, 4 or 5 trimesters of clinical work. And that's all I did was go in and do clinical work. I was my clinic, did my clinics, had my clinical patients and so forth. And that's an accredited degree program, right? It's an accredited thing. You're not going to find that in Western herbalism where you're getting a degree and you're going into the university and they have a clinic and you're sitting in the clinic and you're doing that. It's just not, you're not going to find that. So the problem therein is, yeah, you can get an actual accredited degree, and it's nice because you have an accredited degree that, depending on their accreditation, if it's regional or whatever, those credit hours count. If you wanted to go and get, put them towards another degree somewhere, or maybe get a graduate degree somewhere, you could count some of that stuff. But none of those are going to give you actual clinical experience. And a lot of the time, unfortunately, the curriculum, and I know this very intimately because I've helped other people who are doing this and trying to make this happen. And I've seen what the curriculum is in many of the, well, of the few accredited programs out there. I've seen what most of the curriculum is, and it's mostly copy paste curriculum. It's curriculum that is safe to say because it's printed in a book somewhere. It's curriculum that's not out on the edge saying, yeah, we have empirical evidence that, you know, this formula works for this particular situation, or, you know, there's no actual clinical um, you know, impetus behind what they're saying. The only exception to that, again, would be like a licensed naturopathic school. So if you went up and did Bastyr University or whatever, you know, then they have an act, that's a clinic and so forth. But that's for a naturopath, right? So the difference is just you know, just to kind of, I know there's a lot of overlapping little areas here, you know, but kind of I'm trying to just give you a lot of it's my opinion, but it's my opinion based on my experiences. Oh, for a job. So Tony, well, I mean, I'm sorry to tell you this, but um, the only job you're going to probably get in herbalism is going to be what you make for yourself.
Yeah.
The only exception to that would be maybe working for somebody in an apothecary or medicine making company somewhere. Um, you'd be lucky to be making much over minimum wage, probably. It's just not there's no help wanted ads for an herbalist or for an apothecarist or for any of this. That's just how it is. It's the same for me for acupuncture, you know, it's a $50,000 degree, and it's not like I'm going to go and find a help wanted ad for somebody for an acupuncturist. I have to open up my own clinic. I have to do my own thing with it. And that's why I did it. And it was worth it to me to do that. But it's really, you know, you really kind of have to be willing to, if this is what you're going to do, whether it's medicine making, it's to start your own company, whether it's online or brick or mortar. If it's clinical, that it's because you really want to help people, or maybe you're prepping for a disaster, or maybe you live in a rural area where people are going to be always coming to you anyway, and you have a community that's already looking to you for that, or it's going to be a situation where you're going to open up your own clinic somewhere.
I will say on that note, with the expectation of just going out and finding a job as an herbalist, he's right. That's not something you're gonna like see posted someplace because it really comes from your reputation as an herbalist and what you can do. So Sam has a teleclinic, and when he posts his hours, they're almost always all the spots fill up, and it's something that it doesn't happen overnight. It's not like a walk into, it's not like going it's not like going to a job in a clinic where all of the clients are already there. You create your own clients through your reputation. But this, just like in the apothecary, and this is something that I tell students and have over the years, that you can't expect that people are just going to magically discover you if you don't put the work into it. So with our apothecary, we have put years of work into it, and we reap the benefits because we have people who've been purchasing formulas for going on 12 years. And whenever they need it, you know, they order this certain formula that has served them well for that long. And so it is something, if you're expecting overnight to be making a ton of money. It's he's right. It's not something that's just going to magically happen, and it does take the field of natural medicine does include, or it includes a bit of work, and it's really ideal for a person who's not going to be scared away by having to like and get involved in the community. And this is something that I try to always stress in the classes that I do, because in nursing, what I see is I go and I work in a hospital, and there's that structure, and you're incredibly limited by what you are allowed to do within that. And it's a very hard reality of that. And outside of that, working with herbal medicine or natural medicine or functional medicine, that little box is a bit bigger. It's what you make it. And so, yeah, it's going to definitely include a bit more establishing yourself within the community, which is why I always really emphasize to students ways that this can be done. And this is something this month in particular. on social media and through our newsletter and everything, my emphasis is on ways that you can establish yourself in the community so that people know who you are. And then they remember, oh, yes, this is the herbalist who made that incredible tea that made me feel better. And it's things like that that will get people coming back to you. And it can be that simple, a cup of tea. But it is something that is a starting point for creating a whole practice. And yes, we do have students who open their own clinics, and we have students, we have a really well-known student who opened his own apothecary, and it is incredibly successful. So it's definitely, it's, it's what you make out of it.
And Dana, that's kind of what Herbal Medics started out as, actually was the textbook for our austere program originally, is how I started it in a three-ring binder, and then eventually became a book. And of course, then it became a published book through a publisher instead of self-published, and ended up getting streamlined in a lot of ways and some things added, but that was kind of it. And actually, and I didn't plan this at all to be this way, but the same publisher, Story Publishing, then asked me to do the book that just came out, which is Survival Gardening. And in a lot of ways, that so we have four. I know this may get confusing because we're talking about just the herbal side of the school, but originally the human path started with four major paths. They were the medic, or the medic, which would this could get into a lot of depth. The whole logo, the runes behind that, all of the thought behind that was something that I created over a period of many years. And so the idea was, each path was a relationship between your concept of who you are and some aspect of life. And the medic was your relationship between yourself and the human body. So it had two sides, sort of like Chinese or Asian martial arts. It had the healing side and it had the self-defense side. So it was your relationship to your body and to the body. And so that was the medic. There was the off-grid engineer, which was the relationship between our mind, sort of the state of mind that we're in all day, every day, pretty much in the West, which is problem solving, the analytical side of our mind, right? Each one also represented by an element, by the way. And then a third one was the what we now call the provider. It used to be called the hunter-gatherer, but now we call it the provider. And that was the idea on a team now, in our herbal medics team. So each of these actually gets, you can take them as a whole, or you could take them and drill them down into something like an herbal medics team, which is what we do with our outreach program. So the provider is actually a function of taking care of the food, the water, the sustenance, and the health and the care, the overall, kind of infrastructure of how we are able to make sure we are nourished enough to be able to function as a team. And so there is actually a provider role that we rotate through different students when we do our outreach program. So if you're doing an herbal medics like the one in Nevada that Suchil was talking about, we rotate. It's normally we're either put up maybe in some little, house somewhere, or normally a lot of times we're just camping. And so we rotate through, the cooking. We get all our food together, as a unit. We have all the food, we pack all the stuff, and we have a menu, or we create a menu together, and we rotate through who's cooking. The provider is also the medic for the team, so they're checking in to make sure everybody's okay. And we've had some, we had some problems in other countries that caused this to be. It's like we really need this role to be part of the team so that we make sure nobody's left behind, nobody's ever sick without us noticing it. And so a lot of times the provider gets their own, they get to play medic a lot, because there's usually somebody on the team who needs some help. So they're doing the intake on that person and helping that person on the team. That provider role. Anyway, that also very much went down to the permaculture classes that we used to do, and all of the homestead gardening, all of that was growing your own food. Well, guess what? The second book I wrote was the textbook really for the provider is survival gardening. And then I just finished, well, we're done doing what's called second pages this month, but then it's done. I'm done completely with my third book with them, which is all about water, procuring water filtering water, drilling it out of the ground by hand, finding it, collecting it off the rooftops in the rain, purifying it, dealing with waterborne diseases if you get them. How would we get water in a situation where there was no water available to us anymore? And so that's what that one's all about. Well, that's kind of a big part of what the off-grid engineer was. So it's funny because the only one that hasn't been written on is the Scout, which that's what our MAP, our medical advance party is we've distilled all of the other survival courses we did for so long down to the MAP course, which is all very specific to, again, a medical outreach team, and the infrastructure needed to be able to do that. How do you recon a situation that you're going into, not just physically, but socially, language, ethics, cultural issues that you might need to be aware of, ingress and egress routes, emergency situations. What's the nearest? What are our nearest emergency facilities if we needed them? How could we get everybody out if we had to do that? All of that is what's now called the MAP program, or again, the Medical Advanced Party program. So, or Medical Advanced Party, not program, but course that's now taught by Rick Murphy. So, where was I going with that? That is kind of what the Scout became. It used to be the Scout was all the cool ninja stuff of running around in the woods and like reconning and trying to find other people and stuff like that. And now it's really all very medical, as everything has become very distilled down into medical subjects for us. So I guess that fourth book, I still have one more to write for story publishing, but I'm not going to do that. I'm going, any book I'm writing from now on, it's going to be herbal. I've got an entire clinical book and an entire medicine making book, a 2-volume set that's up here in my head, and a lot of it's in spreadsheets, and I'm putting that together, and that'll be my next non fiction book, probably, or volume 2 book set, whatever. Okay.
Thank you, Sam. I want to cover these other 2 programs, so I want to make sure I leave enough time, so I'm going to go through these with you really quickly. The first one is the medicine making program. What you see here, this one has not been updated yet, thanks to the flu, but it will be. It will be. It's going to be updated here pretty soon here. So it starts off with, and this can be done faster or slower, depending, just like the clinical program, depending on how much time you have. And I will stress again, this diagram that you see here is going to be updated. This is not the most recent. It just got stalled out by the flu. So there is an 8-week online foundation course that covers internal and external medicine making. Some of you here have already done when it was separate as 2 different ones. So going forward, we kind of distilled this into the topics that people are the most concerned about. And so it is all in the 8-week course. We send you an herbal lab kit that has all your materials for it so you can make the medicine at home. It is every August, and so it allows you to be able to do medicine making from home. We have I think 4 live sessions with me where we go through and we talk about medicine making, how to set up your apothecary, things that you really need to be concerned about if you want this to be a successful business. All right. This one, you're going to see there's a little bit of cross-pollination. You see the formulations and formulas class there. That's the one in the clinical, and you will find often in our programs that there's a cross-pollination where this course may show up in clinical. Once you take it there, you don't have to take it twice because it also applies to this program as well. It's 3 weeks, it's online. It's a really good explanation into how to work with making your own formulas. And then this one has 6 advanced courses here. You can see them laid out here. These are intensives. Right now, we are just starting this week. We started with GMP, which is kind of the backside of medicine making. I think I just did an example this past week on GMP where you're thinking, when am I ever going to need this? And in our apothecary, about 6 months ago, there was a jar that was labeled as comfrey, the cut and sifted comfrey, and no one thought that it looked like comfrey. And it said comfrey, and with the botanical and the common name on it. And so we set it on a shelf, completely unsure as to what to do with it. And we all agreed that we could not put it on the shelf for use if we weren't 100% sure that it was what it needed to be. Thankfully, we have all of our GMP paperwork in line, and I was able to go to the correct binder and find out, because it's labeled, and it was labeled with where we got it from and the date. And I was able to look it up, and it was comfrey. Yeah, so we were able to put it on the shelf, and we were able to identify that it was correctly labeled, but only because we follow GMP guidelines for making sure things are labeled correctly, making sure that we have a paper trail that leads us from start to finish on anything that we are either making in medicine or, equipment or raw materials coming in. So GMP is actually a really important class and teaching medicine makers how not only to keep everything straight, but to be able to follow through. If somebody comes back and says, "Hey, your medicine made me sick," or "there was something in this bottle," you would be able to trace it all the way back to the first herbs that you used in order to be able to determine what the problem was, or was the problem kind of a user, not a user error, but something that was a preference on the part of the person who consumed it. So you can see the 6 classes that are here. They're intensives. Every one of them has a lab kit that goes out, including GMP, so that students are able to make the medicine, take pictures of it, submit it, and then attend live sessions with the instructors to troubleshoot any problems that they have. We have been doing it this way since COVID, and it's something that is constantly flexing and expanding and changing. And so because of that, you can see down below there are makers workshops, which are 2-hour dip your toe into different topics. And you can see we got 24 of these, and they are offered over 2 years, one a month, more or less, for 2 years. And so you can just choose from any one of these that really is an area that you want to learn more about. And I've done these specifically so that even if there's a topic here, like the botanical bath, that's actually one I'm teaching next Thursday online. And that one, it is not replicated in the advanced external medicine. It is not replicated in the 8-week foundation course. There's no repetition. We may speak about, like, this is a hydrotherapy technique that you would use to affect sore muscles or to affect a certain condition, but we get into a lot more detail in each one of the workshops or in the intensives, but I don't waste anyone's time by just going over the same stuff. It's always different, or we're working with different herbs and so forth. So this is the Apothecarist Medicine Making Program. And again, this diagram will be updated. Okay. Okay, and then I want to go over this one while we still have a little bit of time here, because this was a request here. So the Austere Medicine Program, this one is, I think, of all the things that we do, this is the one that resonates the most deeply with me, and this is what led me to go into nursing, because I wanted to be able to have that language and that skill set of what do you do when there is no higher care? Well, guess what? I did not learn that in nursing school. Nursing is sadly something, the majority, like 99% of it, happens in a hospital or a clinic. And if you want to know what do you do when there is no higher care, you must seek elsewhere, which is it's funny and it's ironic that it was taking a Dr. Pearson. Steve Pearson is one of our doctors on the staff, and he specializes in emergency remote medicine. I took his trauma course, which you can see listed here. It's in the level 1. It's Austere Medicine Trauma Focus. I took that course, I think it was maybe 6, 7 years ago, and I thought, oh my gosh, I need more of this. So I thought more of it meant nursing school, and it turned out no. So this program here is a program that is, we do cover things like wilderness first aid, as you can see. There's a really good foundation both between what you would do in higher care, understanding that, like what do you do if somebody breaks a bone, But what do you do if you are too far away to get to urgent care? What do you do if you were in urgent care? What would that look like? So understanding both of those things, I think, is really important. And we do make sure, and we get a lot of the people who go through this program are very interested in knowing the answer. What would I do if there's, like, Hurricane Helene and somebody has diabetes? And this is true. Somebody has diabetes and they can't wear their shoes, and they have diabetic ulcers, and they're walking around in contaminated water that is contaminated with feces and chemicals and all different types of toxins that are in this flood water, and they're breathing in the residue as that flood water dries and becomes dust, and they're breathing that in. What can we do about that? Those are questions that are not answered necessarily in medical school or in nursing school or PA school. These are things that you learn by either working in remote post-disaster environments or by pursuing a program like this, quite honestly. This program speaks to me profoundly because every time there is a natural disaster, and there are plenty, you look at the wildfires in California, you look at the flooding that happened, and the hurricanes that happened on the East Coast, and the extreme droughts and wildfires that are sure to follow this summer. This is all incredibly relevant. It affects all of us, and it is knowledge that I feel deeply passionate about sharing with people. So you can see there are 3 levels to this program, and the courses, it goes from wilderness first aid with the herbal first aid 8-hour module, knowing how to put together your own kit, understanding in level 2, if you're bitten by a scorpion or you're bitten by a brown recluse, what's that going to look like? What would happen if you went to higher care? What if you can't get to higher care? What things do you need to be thinking about? Okay, so these are all things that are a part of this program. And this program, by the way, will grow. Currently, there are 3 levels, and that 3rd level is our 10-day austere home course. Simone has taken this one. And this year, I'm going to be playing, now that I have my nursing degree, I'm going to be playing a significantly larger role with bringing austere nursing into the fray. So this is something that for 10 days, we walk through students. They get everything from their WFR while they're on site, but they also are getting a various different certifications like CPR, AED. They're going to get the Stop the Bleed. There is a TECC, which is a Tactical Emergency Casualty Care. This is the type of training that you see in school type of environments for shootings, as well as extensive. You will not find this type of training at the Red Cross. I'm sorry, you simply won't. You may find Stop the Bleed, but you're not going to find out how to do and the correct steps for doing a lot of the things that are covered here, doing medical outreach. How do you set up a clinic for real? How do you work with people in the field? How do you address when somebody has dirt in a laceration? What do you do if they're going into shock? All of these are questions I want to know the answer to, because I want to be able to think calmly enough and to think, okay, this is what I'm looking at. I understand that. This is what needs to happen. I understand that. Do I have the skill set to do it? And we're talking about life or death. Like there is no higher care. And we're seeing that, hurricane, post-hurricane, wildfire. You have to figure this stuff out. And so these are things that we talk about, and there are a lot of people who want to be able to do something that makes a difference. People who want to do medical outreach, people who want to go to other countries and serve under cared for areas, and these things, and specifically the Medical Advanced Party course. Where is that one? That's in level 2. That's actually coming up this spring in about a month or so, 2 months. Is a fantastic course. If you ever see yourself as being someone who wants to go out and help people, first you need to know how to make sure that you do not end up as a liability to other people, but by becoming injured, by doing something that puts other people's lives at risk, or by doing something that is not safe. Okay, so this is the austere medicine program, and I get really excited about this program because it does bring in elements of clinical herbalism, medicine making, family herbalism, all the things that we've been talking to you tonight about under one roof. And this is, when we talk about herbal medics, this is kind of this is the formal manifestation of that. And it's a place where you can really be able to actually help people in a life or death situation. It's great if you have EMT or paramedic or nursing or other healthcare training. But when it comes down to it, if you're the first person on the scene in the middle of nowhere of a car wreck, understanding, okay, this looks like a broken bone. I understand what needs to happen here. That really makes a difference, or being able to speak to people and talk them down from a full out panic. Those are skill sets that I want to teach people. Okay, so this is the austere medicine program. We've talked about the clinical program, the medicine making program. Who has questions for us before we wrap up for tonight? And please remember, if you have any of the diagrams that you would like me to send to you, make sure that you reach out to my email, which is thehumanpathschool@gmail.com. Tell me which ones you want, and I will send you those. Jolyn has a good question here. Sam, did you already answer it? Yeah, you did. Okay. Okay. Okay, I'll answer this one. Would you say the difference between apothecary medicine making and clinical herbalist program, one is more herbal medicine based, medicine making focus, and the other is more treatment of people? Yes. However, I just went over this in the intro class the other night. I personally feel like you need both. It's like you've got a clinic, and then the front of the clinic, you have the person who's sitting down and doing the intake and understanding, okay, this is the herb that I'm going to use for this respiratory illness, and this is the herb that's going to go with it. And in the back, you have your apothecarist who is back there making the formula. So you have an herbalist who comes to the back and they're like, they tell you this has 4 ingredients and one of them is going to be black pepper. And it is up to the apothecaries to go, well, hold on a second. Wait, you don't mean equal parts, because black pepper or yellow jasmine or pick a toxic herb, if you have it in equal parts, that's not going to be something that's safe or palatable for this person. So if the apothecaries, if the clinician does not realize about the dosage that is needed for a certain herb, they could make an error that could compromise the formula as being safe. And on the other side of things, you may have an apothecarist who doesn't understand what an herb is used for, or that there's something with a very similar name to it. And some of them are very, very similar, and they could miss that. So I believe that having the two worlds, having a knowledge in both areas, makes a truly strong herbalist. It's kind of like being a cook and only understanding how to cook food as opposed to having the knowledge as to like the nutrition behind the food for someone who has cancer, understanding what goes together and when it is indicated. So yes, they are two different skill sets, but they really should be, in my mind, to be a competent and complete herbalist. I really feel like people should explore both worlds. Okay, I talk a lot, I know. Um,
I think that like one of the things that what Suchil just said kind of underscores the need and the fact that learning herbalism, learning herbal medicine is definitely a non-linear path. And so don't hold yourself to a linear path in the way that you would doing a more kind of what's the word, standardized Western medicine. So for Suture going to nursing school, or when I got into med school, when I was 42, and I had to choose really between family or med school, and I walked away from med school. But the path of getting into med school and starting into med school was very, very by rote. Like, there's this, and then you got to do that, and you got to do that. Any of the STEM subjects are going to be very similar. You have to build one thing on another, on another, on another. Herbalism isn't like that, and I don't think the plant medicine is like that, and I don't think plants are like that. I don't think nature is like that, and that's why. So it's nice to be able to do a little bit of this and a little bit of that, and understand that as an herbalist, you need to understand some botany, you need to understand some gardening, you need to understand plant identification and plant harvesting, and then medicine making and clinical skills, general clinical skills, and formulation, emergency stuff, first aid stuff, all of these pieces are, and many more. And then there's all the business aspects of it, and there's the GMP, and then there's just the language of learning how to talk to allopathic medicine and be a translator. To a lot of what I do is I'm a translator between this world of herbalism, which has a Western, like the medical herbalism kind of renaissance that's happened, and then you've got, the TCM, energetic medicine. You've got traditional Greek medicine that kind of made a resurgence here in the U.S. You've got, kind of the wise woman traditions of European and even Middle Eastern medicine. You've got, of course, Ayurveda. You've got all sorts of indigenous medicine roots all over the planet. If you can know a few of those languages, at least very competently, and be able to translate those into concepts and words that are understood in an allopathic community, you will be it will help you greatly. At least I've found that, and I've worked, integratively with so many different. I've been fortunate, with different doctors, with different NPs. I've really had a lot of good fortune in that regard, and I've gotten to work together on cases that were really like life-threatening cases where herbs came in and saved the day. And my ability to do that was because of the fact that I was able to talk to, a medical doctor or a DO, and be able to speak in a way that they said, okay, I could tell, like in their eyes, that they didn't glaze over, or they didn't look at me like I was an idiot or like a nut job, or like I was, running around like a hippie barefoot in the woods. Trust me, I am a hippie and I love running around barefoot in the woods, but that's not, who they saw. They saw somebody who spoke their language and who could speak to them on those terms, and explain even things that they weren't aware of, back in the days of when I was first into biofilm, before anybody else was in allopathy. But it was interesting. It was like, oh, when they go and Google it, and they'd be like, oh, this guy knows something. So these are the things that I think, we love to have students come out of our courses and be competent in that way too. So there's a lot of information I write, but I just wanted to say that your pathway through that can be absolutely nonlinear and should be somewhat intuitive as to what you want to learn, because your curiosity for subjects is what will drive your ability to learn and to remember. You have to be curious about something in order to remember it. If you just force yourself to learn something, you won't remember it if you're not curious about it. I hope that makes sense.
Absolutely. That's really well said, Sam. And I want to kind of conclude that thought by saying a large part of what our programs are designed to do is to raise the bar of herbalism. And we have seen this, we chuckle about it from time to time, that when we started the school, the standards for herbalism and the standards for the RH were very different. They were a bit lower, and the comprehension of herbal topics was different. And now Sam he has certain terminology that he uses that now is used by other herbalists. It's something that's caught on. And it has absolutely, we have noticed over the last 15, 20 years that the world of herbalism has started to catch up, and the standards are higher. And the language, like just the intro course that we have this time around, is like people in the intro for beginners class are asking questions. It used to be, Sam was just saying the other day, years back, it was like, well, what is an herb? Is it like is it something that's, uh, is it a weed? And now the questions that we get are just like mind blowing. And the landscape of herbal medicine is changing, and one of our biggest desires is to make sure that as an herbalist, whatever level you decide to be at, or medicine maker, you can have language so that people will take you seriously. And they will be like, okay, yes, this is a clinical herbalist, or this is an apothecarist, or they will understand that you know enough to not be dangerous. And that was not necessarily the case, in the past. And that is why herbal medicine has got a little bit of a reputation that it has had to overcome. And many people feel like it should not be regulated and it should be this grassroots um, type of medicine, and that's fine if that's what you want it to be. But if you're looking to really make an impact on a global scale or a community scale, at the very least, you need to be able to instill confidence in other people. Okay, so I think we're gonna be wrapping things up. Sam, do you have anything else you want to add for tonight?
No, I wasn't sure if you saw the questions from, let's see, it was Danny and who
No.
else? About bundling courses. Oh, Laura Sweeney as well. So,
Sure.
they asked
Anyone who
about,
would like to bundle a course, you see my email, thehumanpathschool@gmail.com. Please send me an email. We will bundle anything 3 or more classes. Just send me an email and I can walk you through what that looks like. I can send you any program diagram. I can even do a phone call with you this starting next week when I'm back home. And I can go over any questions that you have specifically on where do you start, and can you do 2 programs at once? Yes, you can. And all the questions that you might have, I can certainly help anyone who has anything that they need.
Carolyn's asking when the next Bites and Stings workshop will be.
That's every July.
Okay.
Mhm. Every July. And I think if you sign up for some of these, don't wait because they're on early bird special when you sign up earlier. And it allows you to be able to have a lower tuition. So you get those early birds, you just sign up through Eventbrite, and it will give you a lower cost. So it saves you a bit of money. Anything else? Okay. All right, everybody. So I think that this is everything. I sure do appreciate everyone for attending tonight.
Yeah, thank you, everybody. Great questions and good to see you all. And some of you I've seen in the classes. Look forward to seeing you in those and take care. Have a good rest of the evening.
Right. Good night, everyone.